Welcome to the T-Level Healthcare Science Core Assessment Employer Set Project Task 4, present an overview of Quality Improvement Report. In this presentation, we will guide you through the details and key considerations for Task 4. Please remember that the information provided here is based on data available as of September 23 and may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. Task 4 is the presenting an overview of the Quality Improvement Report task, and it plays a crucial role in the ESP. There are two parts, Task 4A, preparing to present your Quality Improvement Report, and Task 4B, presenting and discussing your Quality Improvement Report. These can be done on separate days. Let's delve into specifics. Students are required to create a presentation using software such as PowerPoint, giving an overview of the Quality Improvement Report for discussion with the tutor. Students have a maximum of 2 hours to prepare for this task, which may also include practicing the verbal delivery of their content. This task is not marked, but forms the basis of Task 4B. Resources required for Task 4A are the project brief, computer and presentation software, copies of research from Task 1, original copy of the report from Task 2, and amendments to the report from Task 3B. They will also need Task 4 pro forma and any other requirements stated in the provided guide for each specific assessment series. Task 4B is the discussing and presenting of the Quality Improvement Report, and it plays a crucial role in the ESP. Students are required to present their overview of the key elements of their evidence from Task 2, including their justifications and appropriate commentary from Task 3B. Tutors will assume the role of a supervisor in the relevant occupational area referenced in the brief and take part in a discussion where the student will present an overview of the report prepared in Task 4A before being questioned by the tutor to provide further rationale for the approach taken. The questions will be supplied by CFE, and tutors must select and use the most appropriate questions based on the student's presented overview. Question options provided in Provider Guide. Tutors should select appropriate questions prior to the student presentation. The resource requirements for this is the project brief, evidence from the previous task, 1, 2, 3B, 4A, assessment sheet for tutor questions, audio recording equipment, and any other additional resources as Provider Guide for each assessment series. Evidence requirement for this task are the materials used to prevent overview, presentation slides and word processed document or pro forma, audio recording of discussion in response to questions, tutors' observation notes of the discussion on provided Q&A form, and any other evidence stated in the Provider Guide for each specific assessment series. And understanding how Task 4 fits into the project, it becomes clear that each subsequent task relies on the foundation laid in the initial stage. The research conducted in Task 1 serves as the foundation for the entire project. It provides the necessary background information and context for subsequent tasks. The findings from Task 1 can be incorporated into the introduction of the presentation. The research gathered in Task 1 not only serves as an introduction, but can also support the justification for the responses to feedback received in Task 3. Students can use their research findings to underpin the reasoning behind any changes or improvements in the presentation. Task 2 involves the creation of a quality improvement report. This report, with the feedback received and the subsequent updates from Task 3, form the foundation for the presentation in Task 4. The presentation is built upon the content and insights from the quality improvement report. The responses to feedback received in Task 3 and the justifications for changes made to play a significant role in Task 4. The presentation. Students need to incorporate these elements into their presentation, showcasing their ability to reflect on feedback and their decision-making process. Finally, after completing Task 4, students will engage in self-reflection, which is essential for continuous improvement and learning. The reflections in Task 5 can provide valuable insights into the effectiveness of their presentation and the overall project. This feedback loop ensures the project's outcomes are used to further enhance skills and knowledge. Task 4 offers an opportunity to demonstrate various core skills. You have research skills, communication skills, and reporting and presentation skills. To demonstrate these core skills, it's important to consider these key areas. The presentation will be sufficient length to comprehensively cover the project outcomes, including the knowledge and understanding gained throughout the project. This ensures that students convey the full scope of their work and insights effectively. In the presentation, students will effectively communicate a summary of their quality improvement report. This includes presenting the key findings and insights from their research, analysis of the project brief, and an overview of the report's content. They will explain the content of the quality improvement report by drawing on information obtained from the research and the project brief. This demonstrates their ability to integrate knowledge into their presentation, reinforcing the understanding of the project. They will dictate ample time to present justifications for the changes made to their quality improvement reports based on the feedback received. This demonstrates the depth of their understanding and critical thinking in response to peer feedback. During the discussion, student will actively listen to the questions posed by tutor and ensure a complete understanding of what is being asked. They will provide thorough and considered responses, avoiding simplistic or incomplete answers. By ensuring that their presentations are of appropriate length and addressing these key points, students will effectively demonstrate their knowledge, understanding, and the ability to engage in meaningful discussions during task 4. Now we're going to explore how to maximise student success using the Autumn 22 Grade C exemplar. The examiner commentary from the task to highlight key areas they can maximise success, alongside the descriptors for the marking criteria bands. Using this as an example process, this could allow a way to measure student achievements. So let's explore some of the key areas of the Grade C students and what they demonstrated and what they could do next to achieve a higher level band. So you used the Chief Examiner's commentary on the students' work and cross-referenced that with the grading bands. In regards to knowledge and understanding of the project outcome, AO2, the student demonstrated a reasonable level of knowledge and understanding of the project outcome. There was some discussion with the tutor. To achieve a band higher than that was evidenced of band 2, the student should aim for a comprehensive understanding of the project outcome by referencing national guidelines and areas of good practice in the context of a healthcare setting. Engaging in more in-depth discussions can contribute to this. In regards to demonstrating knowledge of peer feedback and quality management, we have evidence here of band 2 criteria for AO5. The student effectively demonstrates some understanding of the justifications for changes made following peer feedback and the reasons for ensuring quality of care. They confidently answer questions from the tutor. To achieve a higher band in AO5, the student should aim for thorough understanding of the justifications for all changes made based on peer feedback. Demonstrate an excellent understanding of quality management requirements is key, including detailed responses to tutor questions. And finally, in regards to AO4 digital skills, the students' evidence criteria from Mark 2. So the summary and presentation of the report demonstrate most effective use of digital technology, making information clear and accessible to the intended healthcare audience. Data is processed and conveyed well. So now that we've looked at an individual student, we're now going to look at some key themes in Task 4B from the Chief Examiner's feedback from Summer 23 series. There was significant variation in the length of students' presentations, with some lasting only 2 minutes and others extending beyond 10 minutes. The length of presentations impacted the depth of detail and demonstration of students' knowledge and understanding of the case study, national guidelines, good practice, and their conclusion. Students' confidence grew as they spoke about their work, overcoming nervousness during their presentations. The quality of recordings was crucial for effective evaluation, ensuring that students' voices were clearly audible. Poor recording quality could lead to difficulties in assessment. Providers needed to ensure that complete recordings were submitted, as incomplete submissions, for example, only tutor Q&A, limited students' access to available marks. And Task 4 included 2 marks for digital skills. These were awarded when evidence such as presentation slides were provided showcasing the students' ability to use digital tools effectively. So in summary for Task 4 of the Healthcare Science Core ESP, presentations should thoroughly cover project outcomes, indicating a deep grasp of the project scope and objectives. Students should effectively summarise the quality improvement reports by emphasising key findings and insights, ensuring a clear conveyance of the project's core message. Demonstrating understanding through the explanation of the quality improvement report's content, drawing insights from research and the project brief. Presentations should allocate time to offer well-founded justifications for the changes made to quality improvement reports, showcasing critical thinking skills. Active participation in the discussion is vital, with students delivering well-considered responses to tutor questions, highlighting their analytical capabilities. An effective use of digital tools to present information and data is essential, demonstrating competence in utilising technology for communication and presentation. Thank you for watching. We wish you the success in the T-Level Healthcare Science Core Assessment Employer Set project.